can someone identify whether or not they are experiencing trauma?
Well, so a lot of it has to do with, first off, I just want to address something that you brought up exactly on vicarious. I think there's a lot of it going on right now. The last time that we were as a society were dealing with this much vicarious trauma was probably the couple of weeks after 9/11. When it was inundating the news. If you remember, they were telling everybody to stay home, sort of the same. It didn't last as long as this, but some of the same things were happening. And yes, we do know that African American and Latinos, Black and Brown people they seem to be higher numbers of cases in our community. There's definitely a higher number of deaths. And yes, we are dealing with pre-existing conditions, and I agree with you that it is not all based on personal choice. It's everything from fresh food shortages in our neighborhoods to to people being trapped in the neighborhoods, to people more likely to work, for instance, right now, more likely dealing with job loss due to the fact that most of us in Black and Brown communities work jobs that you can't social distance on, or not, you can't work from home on, or all of those things are absolutely true. And we need to be studying them, as a Latino, I'm definitely concerned about my community in the things that we're dealing with. We tend to live in urban areas that it's harder to social distance. Just whereas in less urban areas you have more room to spread out. So yes, all of those things are absolutely true. So we need to. That is something that we obviously have to continue to talk about. And we can even the issues when we're looking at for instance how fast this is spreading in prisons, and jails. All of those things are part of what we need to look at. But let's talk about what are the symptoms of trauma that we start to see. So symptoms of trauma are going to be things like, I flip my page over here. Let me come back to it. If you are after the incident, if you can't stop thinking about whatever this incident is, if you can't stop thinking about the trauma, if you're upset or fearful or fearful, if you're unable to escape intense, ongoing, distressing feelings related to the trauma, if your relationships are suffering as a result of this, if you're feeling jumpy or shaky, if you're having nightmares related to the incident, if it's impacting your ability to enjoy life, and the symptoms are interfering with your daily life, that's what we describe as symptoms of a trauma, as basic symptoms of a trauma. Now, one of the most common responses to a trauma are panic attacks. So when we're looking at symptoms of panic attacks, you'll see things like, and they look very similar to heart attacks. That's why a lot of people are not necessarily sure what it is. And I will tell people, if you don't know the difference, you've never had one, you don't know the difference, don't try to say, oh, this is a panic attack, not a heart attack. Or if you're a caregiver and this individual has never, that you know of, ever had a panic attack, or they don't describe that they've ever had one, assume you're dealing with a heart attack, and seek and seek medical attention, seek 911. But some of the symptoms are pounding heart, breathing issues, rapid breathing or shortness of breath, sweating, trembling or shaking, numbness, tingling, chest pain, nausea or stomach pain, dizziness, feeling lightheaded, faint, feeling really unsteady, feelings of being detached from reality. So, and a lot of times that's one that you kind of process later. But a lot of times people who have panic attacks will describe it as sort of being on the outside of the body looking in, having a fear of losing control in the situation, or chills or hot flashes. So all of those things are a various combination of those things can be going on with someone having a panic attack. So those are the symptoms you're looking for. The symptoms of if someone is in immediate distress, having a panic attack, or the sort of general symptoms of trauma that are just sort of, I can't sleep, I can't seem to eat right, I I'm having nightmares all the time. I'm really shaky and unsteady. I'm afraid of people, you know, or afraid of things that trigger, you know, that may trigger. And especially these things really come up anytime you're around sort of a situation that might be similar to the trauma itself. You know, so say the trauma happened in a small space. You may never be able to go into, it may take you a long time to be able to go into a closet again or something, you know, anything that you could. So if it sort of like looks like, smells like, feels like the experience, it can trigger, you know, and you aren't always aware that the trigger's coming, you know, and it can be sometimes you can be in a similar situation and not be triggered, but maybe the next time you're in that situation, it's, you know, it may trigger again. There's kind of like, unfortunately, there's not always a rhyme or a reason to it, you know. But those are the basic symptoms that we look for in someone. Is now, immediately after someone's been traumatized, it's very natural to have those symptoms and it not necessarily be PTSD. When we talk about the line crossing to PTSD, and I'm not giving anybody the ability to start diagnosing here, you know, but when you start seeing when it actually is crossing the line, is usually 4 to. Sorry, hold on. Hold on, somebody was calling in on my phone. But somewhere 4 to 6 weeks after the trauma is when you'll be able is when you'll be when we start looking at whether this is crossing the line to PTSD. You know, so that's it. You know, like 4 to 6 weeks after, and you're still having those symptoms. Maybe you're still having panic attacks, or you're still having nightmares, or you're still, you know, unsteady. That's when we start saying, yeah, this is sort of classic PTSD. And that's when the person.
Go ahead, sorry. And dealing with caregivers and healthcare professionals, nurses, doctors right now who are on the front line in the hospitals and these medical facilities, as they are dealing with things that they have never seen before, the magnitude of death, the magnitude of sickness, the magnitude of not having available the personal protective equipment that they need, or the life-saving equipment that's needed.
Yeah.
My concern is for the healthcare professionals, after we get through this, after things calm down, what do you suggest for people who might be experiencing anxiety or stress during this time? What are treatment options available?
So here's the thing. Right now, in the midst of dealing with the ongoing trauma, it's very hard for us to treat it professionally. One, because everybody's gone to telehealth right now, and there is kind of sort of an overwhelming need. It is also very hard to treat an injury, because this is an injury. So think about this: you have a physical injury. It's very hard to treat an injury if you're still being re-injured every day. You know, so one thing about it is that the injury almost has to stop happening. You know, I mean, this is sort of like treating this while it's ongoing is sort of like, you know, treating a gunshot wound while the person's still being shot at. You know, if you understand what I'm saying. You know, and I don't mean to be that graphic, but if the injury is continuing to keep happening, it is hard for us as professionals to mitigate that while it's happening. So what we can talk about is some things that an individual can do to sort of mitigate the damage, help themselves cope while they're in it, and then so if they still need professional help afterwards, because not everybody who's been through something traumatic is necessarily going to need professional help, but there are some things that we can do to really to mitigate some of the damage from happening, particularly for the vicarious stuff, and for even the things that are happening to us in the meantime while this is still going. Because to be talking about trying to put somebody in trauma therapy right now while this is ongoing is just really hard. You know, so one of the things that we can do, and it may sound like it's, you know, silly, but it really is, how well you negate the effects of something crossing the line between being a traumatic response and actually becoming PTSD is really how well you're practicing self-care in the meantime. You know, self-care is almost like a preventative to PTSD.